This year has seen changes to Minnesota's health insurance ecosystem, and with open enrollment approaching, those changes will soon hit the public, particularly seniors with Medicare who use insurance agents.
Aaron Stuvey has the story.
In just a couple weeks, open enrollment season will begin, and insurance plans will need to be locked in for the upcoming year. There are some changes on the way, especially for seniors who use insurance agents to navigate their insurance options. Usually, those agents are paid by the large insurance companies on commission for helping people find the right plan for them. Now, those companies have gradually started to stop commission payments to agents, and agents by law can't charge clients themselves for work done, meaning the entire industry is up in the air as agents have no sources of income.
It comes from CMS, Center for Medicare Services. They have allowed these insurance companies to not pay agents because their bottom line is hurting. UCare just left the state.
Many seniors have been working with their agents for decades, and with it becoming harder and harder for agents to stick around, many will now be forced to navigate the muddy waters of insurance plans on their own, many for the first time in decades.
I can't believe that we won't have this kind of help, especially senior citizens, but just everybody really, to be able to understand this. They spend so countless hours doing their work.
Now agents and clients around the country have been contacting their legislators to try to make a difference. But those in the industry say that the change will have to come from the insurance companies themselves.
At the end of the day, we're not asking for handouts. We're really asking to be able to keep helping our neighbors, helping our grandparents, helping our parents to make the most important healthcare decisions of their lives.
Aaron Stuvey, KUYC News Now.
Well,